$7 billion. Would any of you like to have $3.7 billion? That is the amount spent on prescription drugs in the United States in 2010, according to Reuters. I've worked in pharmacy for nearly 3 years, most of which was in the retail setting. Nearly every day I would encounter multiple people who could not afford their prescriptions. I've seen firsthand the difference between the cost of the drugs and the price of the drugs. This evening I'm going to tell you about why I believe that prescription drug costs should be regulated, how prescription drugs are currently priced, and also what you can do to lower your costs now. Drug companies are not currently regulated in the prices that they charge for their drugs. Joan Indiana Rigdon, in the article, "Why Do Prescription Drugs Cost So Much?" states that the free drug market allows you to raise your prices 2 to 3 times faster than inflation. Also, the senior editor of CNN Money, Tammy Lutey, states that 50 million Americans did not receive or fill a needed prescription in 2012 due to not being able to afford it. That's nearly the entire population of Washington, Oregon, California, and Nevada combined. Now, drug importation is illegal. The government insists that medications coming from other companies are not safe. The FDA and U.S. Border and Protection have conducted several blitzes or spot checks on medications coming into the country, and they say that they have found expired, contaminated, contraindicated products, counterfeits, and also that drug labeling was not often in English, and also that medications were stored inappropriately. That being said, many of the companies that we receive our drugs from, through pharmacies and hospitals, are from outside the United States. So, drug trials are required from the different companies, but that doesn't prevent abuse of the system or of the consumer's trust. A new drug, during their trials, it does not have to be proved that it is better than the previous or a competitive product. It only has to be more effective than a placebo. The drug company also chooses which trials they want to run. Drugs are also often tested on groups other than those that are intended to use it. For instance, a drug that's intended for elderly would be used for younger patients in the trials. Marcia Engel, who spent 2 decades reviewing clinical trials for the New England Journal of Medicine, said that trials can be set up in many different ways. Sometimes that new drugs at higher doses are tested against older drugs at lower doses. So, while it does take time and money to create a new drug, there should be limits on the profits. According to Blue Cross and Blue Shield of North Carolina, the cost of developing new drugs are exorbitant, though pharmaceutical profit margins are highest within the healthcare industry. So, how are prescription drugs priced? There's cost-based pricing and there's value-based pricing. According to Pearson Education, cost-based pricing is when the price of goods and services based on the cost of making and selling them. The cost may be defined in several ways: variable cost, total cost of production, total cost, or the total cost plus the profit. And value-based pricing, on the other hand, focuses on the price that you believe customers are willing to pay for the product. Value-based pricing depends on the strength of the benefits which you can prove that you offer your customers, according to Business Link. I believe prescription drug costs should be cost-based rather than value-based. Now, Canada has the second highest cost of prescription medications in the world, only second to the US. However, per capita, their costs are 33% less than those in the United States, according to Keith Spites, who's a former vice president of the American Health Tech and Research Development. Prices are getting higher and higher at an uncontrolled rate. AARP stated that prices for drugs most frequently used in older patients rose at triple the rate of inflation last year. In other countries, drug prices are much lower due to government regulation. The U.S. needs to look at alternatives to the current situation. I have a few examples here from ABC News. Mirapex, which is used for Parkinson's disease, costs $157 to fill in Canada versus $263 in the United States. Also, Diovan for high blood pressure costs $149 in Canada versus $253 in the US. There's a couple of other examples there. $13 versus $70 for Serax, and $33 versus $124 for Seroquel. Now, while prescription drug costs are not regulated, I do hope to provide you with some information on how you can reduce your drug cost, even if it is minimal, just until those prices are regulated. You can ask your doctor for alternatives. As I stated before, drug companies do not have to prove that a new drug is better than an older drug, just that has to be better than a placebo. So, oftentimes there will be an older and cheaper alternative available. Now you can also speak with your pharmacist because they have also a very broad knowledge of different drugs. And finally, there are many drug discount cards. Oftentimes they'll come with specific medications. Other times there's cards that are used for all sorts of different medicines. And finally, I hope you've learned about why prescription drug costs should be regulated, how they are currently priced, and a few things you can do now to reduce your costs. Increasing awareness is the first step to changing this system, and while drug costs are high, help is available. Thank you.